Welcome to The Explainer. Today, we're talking about something that's a real game changer in healthcare access. How you can get your contraceptive pill directly from a specially trained pharmacist, often without needing a new prescription from your doctor.
You know that feeling, right? You look at your pill pack, you're down to the last few, and panic sets in because getting a doctor's appointment is weeks away. It's a super common and stressful situation. But what if there was a simpler way?
Well, there is. Your local pharmacy is stepping up. We're seeing pharmacists with specialized training who can now supply certain oral contraceptives, which makes your life a whole lot easier and your healthcare journey so much smoother.
Okay, so let's dive into our first section. How does this contraception at the counter thing actually work? A huge piece of this new system is the time frame. A trained pharmacist can give you up to a 6-month supply of certain pills, as long as you meet the right criteria. 6 months! That's a massive step forward for making sure you don't have any gaps in your care. So, how do you get your hands on your regular pill? Let's talk about the first scenario, what we'll call the resupply pathway. This is for you if you're already on a pill and you just need more. To get that resupply, your pharmacist is going to run through a quick but really important safety check. First, they'll check that you've been prescribed the same type of pill in the last 3 years. Second, they'll make sure you're in the right age range for that specific pill. And third, and this is the most important part, they'll confirm you haven't developed any new health risks since your last prescription.
Now, the pills you can get this way generally fall into two main buckets. You've got your combined pills, or COCs, which have two hormones, an estrogen and a progestogen. Then you have the progestogen-only pills, or POPs, which, you guessed it, just have the one. The rules can be a little different depending on which one you're on. Okay, but what if it's not about a regular supply? What if you need a backup plan after the fact? Because of unprotected sex, or maybe your usual method failed? That brings us to our second pathway, emergency contraception. All right, let's get something crystal clear right away. How does the emergency contraceptive pill, the ECP, actually work? Its whole job is to stop a pregnancy before it can start, mostly by hitting the pause button on ovulation. It is absolutely not an abortion pill. If a pregnancy has already begun, it won't have any effect.
When you need emergency contraception, you basically have two main options. The copper IUD is by far the most effective method out there, but it does mean you have to go to a clinic to get it fitted. The emergency pill, on the other hand, is incredibly easy to access. You can walk into a pharmacy and get it. It's still very effective, especially if you can take it as soon as possible.
Now, whichever route you're exploring, a regular supply or an emergency pill, the pharmacist consultation is key. So let's talk about that crucial safety check they'll perform.
One really important factor that your pharmacist will talk to you about, especially for the ECP, is your body weight. As you can see from this data, the effectiveness of the pill can decrease a bit for people over 70 kilograms. That's about 154 pounds. This is a critical piece of info for making the best choice for you. And because of that data, the official recommendation is pretty clear. While there might be other things to discuss, like a double dose of the ECP, the evidence really points to the copper IUD as being the most effective and reliable choice for emergency contraception if you have a higher body weight. Now, for anyone on a combined pill, it is so important to know the warning signs for rare but serious side effects, like blood clots. A super easy way to remember them is the acronym ACHES. That stands for severe abdominal pain, chest pain, headaches, eye problems, or severe leg pain. If you experience any of these, it's not a wait-and-see situation. You need to get medical help right away. And besides those ACHES symptoms, the pharmacist is also going to screen for other red flags. Things like having migraines with aura, a personal history of blood clots like a DVT or pulmonary embolism, or certain types of cancer. This is why being totally open and honest during that consultation is absolutely essential for your safety. Okay, so let's tie this all together. What's the big takeaway here? It's all about being informed, feeling empowered, and being prepared when it comes to your own health. What we're really seeing is the evolution of the pharmacy. It's not just a place to pick up prescriptions anymore. It's becoming this accessible health hub where you can get private, confidential, and professional care right in your community. So here's what I want you to walk away with. First, you have options for getting contraception fast and safely. Second, your pharmacist is a highly trained professional who is there to talk with you. And third, knowing your own health is the most powerful tool you have. It's all about being an active partner in your own healthcare.
And seeing this kind of change really makes you wonder, doesn't it? As vital services like this become more accessible and move out of the clinic and into our communities, what else could be next? What other care could be brought closer to home, safely and effectively?